Thank you for joining our next keynote session. It's interesting. There are companies here down in the lower 48 states that have already figured out how to get NUCA-like results in their self-insurance plans. And as was mentioned out earlier, it always comes down to being able to think differently and start to structure the problem in different and in unexpected ways in order to get better patterns and better service delivery, both for the patients, but also to organize the care delivery around it. And our two speakers right now, Dr. Janice Johnston and Dr. David Berg, are the co-founders of Redirect Health, which is a company that has essentially been able to recreate these same types of principles down here out of Arizona, of all places. They're a husband and wife. And they moved from Toronto, Canada, down to Arizona 26 years ago. And the concept being that they were able to bring the best parts of Canadian care and that sort of mentality and bring that to the best parts of American care as well and blend those together. The results in their company with Redirect are unbelievable. They've been reproducing these results, high degree of consistency now for about 13 years. And the costs are so affordable that even for their own employees, they've been able to cover 100% of the care and 100% of the cost, and with no copays, no deductibles, or anything like that as well. And also, before they speak, wanted to encourage everyone to listen to the Entrepreneur MD podcast that includes Dr. Johnston and Berg. The link is included in their display virtual booth here. They also have a free book, A Business Owner's Guide to Ending the Fight with Healthcare, that is a must-read and goes through the process that they've used and outlines why they feel like, hey, the fight with healthcare is both achievable and it's been proven and demonstrated. And excited to be able to learn a little bit more about that today. And with that, turning it over to Dr. Berg and Dr. Johnston.
Thank you, Lee. All right.
Thank you as well.
Terrific.
All right, so let's start with the concept of ending the fight with healthcare. When we first wrote this, it was called Fighting Healthcare. And even though Janice and I have for years felt like we were in a fight with healthcare, we do think it's over now for any company that wants it to be over. So we've changed the title of the book. This is the third version of it. We've updated it. But we've really just, it chronicles a little bit of what we've learned along the way as we've made healthcare affordable for us and our families and our companies and our employees and their families. And when Janice and I moved from Canada, we thought it would be much easier than it was, but we learned it was a very, very complex system. And in order to make it work, and the math wouldn't work for us. And in order to make it work for our employees, we just couldn't figure out how to make the American insurance system, if you will, work. So at the end of the day, we created our own system, one that made sense. And as we're building our practice at the time, 26 years ago, and including taking care of our own employees and their families, we had to ask them as the customer, like, what do you want? What's missing in the system right now? Because we knew we couldn't afford the existing system. So what Janice and I are going to talk to you about today, everything we heard from Doug and April about the NUCA system, it's what we believe in. All the philosophy, it matches up with everything that we've been thinking and that we've been doing. It was a lot of it's logical conclusions that we came to. But what I'd like to focus on, have Janice and I focus on, is for the businesses out there of, well, how can you take like really easy baby steps to get just to get started, to get some of these benefits that might be harder to get if you've got some constraints like we did around money. Right? We don't have any funding when we're doing this. We have to do it for out of profits and cash flow, and all of our clients do also. So you're going to have some constraints that you're going to have to work through. So we want to give you some practical things you can be considering so that you can manage through those constraints and get started. And don't worry if you don't get the same results that the folks that NUCA are getting up in Alaska. You can get your own results. You've got your own people, you've got to serve, you've got your own needs for your company, and we want to help you with that. So what I want to give you is this encouraging news that you can make healthcare work for your company. You can do it. And when I say work, I mean for everyone in your company. You can make it work for everyone in your company, not just the folks with the higher wage earners, but I mean everybody, the lowest wage earners in your company. If you think about it, and maybe this is the Canadian part of us, it would never be acceptable in Canada to only cover or take care of half your family. And it similarly, it wouldn't be practical, wouldn't be, it would just be bad to not take care of 100% of our business family also. So this is about making healthcare work for your company and everyone in it. And that means making it better, making it faster, and making it more affordable. Let's be real about the real constraints that we're facing in businesses. It is about the affordability. In Canada, we saw access being limited by a lack of resources, meaning doctors and hospitals and services and MRI machines. In the United States, the typical American has the same kind of limitation to access, but it's usually because of cost. Now, I'm sure there's other reasons too, but cost is a big constraint. And if we ignore that, the chance of us making it work for everyone in our company, well, we're not your people because we don't know how to do it. So it's really about, we have to make sure the money works. So goals for today. Number one, I'm going to share some key principles in thinking to make your healthcare work better. There's 10 of them. I'm going to go through them fast. And I'm just going to give one point, though I could dive in, do a day or an hour on each one of these principles. But I want to make sure you got some key principles that will, if you just take them to heart, maybe you can't do all of them today, but maybe next year you get a couple more in, and the year after you get a couple more in. And then number two, I want to make sure that Janice is going to talk to you about some really, really minor benefit design improvements. And we've got an example of our exact benefit structure in our virtual booth. And you can look at it and copy it all you want. It's not copywritten, and a lot of it's just logical sense. But some basic benefit design changes you might want to make to your health plan, assuming you've built the flexibility into your health plan. And then number three, the affordability. And I just want to share with you how to get costs. We think the target for a working population is about $4,500 per person annually. But there's some simple things you can do to get it to $5,000, $6,000 per person annually. All in, that means what they spend, what you spend, what everybody spends, but you've got to do some different type of thinking on it. All right, ready to get going? Okay, 10 key principles. Number one, it's about the system. And Janice will talk about that a lot more too when she's talking about the healthcare journey. But it's not just about the better doctors, better insurance. A system is about system's not even about the parts. Doug talked about complex system theory, and I love that stuff. I geek out on it. I won't go into it here, but there is a way of thinking about a complex system, designing it, engineering it. There's also a way to manage it that's different. But the main thing I want you to know is that we've got to think end to end, got to think about it as a system. Don't think about it as its parts. And it's really about making sure there's the relationships between all the parts, between all the doctors and the pharmacy benefit managers and your brokers and advisors, all the parts, 100 parts, that the relationships fit together in an integrated way. Principle number two, start with vision. You have to get clear on who your health plan, your health system is supposed to serve and what success looks like. If you don't get clear on that you want to serve just your executives or just your managers or everyone in your health on your team, or maybe it's just the people who have the higher incidence of work injuries, if you don't get clear on who and how you want to take care of people, let's face it, the executives in your company are going to have a different need than your frontline workers who are prone to injury. So if you're not clear on who you want to serve and what success looks like for those different people in your company, don't be surprised if the vendors of healthcare don't have a really good idea who your system is there to serve them, obviously. Principle number three, everyone in your company. I strongly advise companies figure out a way to make their system fit for everyone in their company. You can be a recruiting machine if you do it. Putting free healthcare in your job ads is the number one way that we've seen for ourselves and over 1,500 clients be competitive in a labor market, regardless of how weak or strong the labor market is. You put free healthcare in your job ad, or like in our case, free healthcare entire family. Don't be surprised if you get way more resumes than you can even handle, and don't be surprised if you have to come up with a new way of sifting through resumes. But I would strongly encourage you to focus on that word everybody, everyone, and ask them. They are the customers of your company, if you will, and ask them what they need. Ask them what are the constraints that they're facing. And a lot of times it might be something as simple as, I thought that medication was $300. I didn't know it was only $2.14. That could be the constraint. So focusing on everyone will change some of the things you do in your company. And you will not find today, unfortunately, a traditional vendor of healthcare thinking about everyone in your company. They will only be thinking about everybody who can afford it or everybody you will pay for. Number 4, healthcare consumerism. Now that sounds like a great word to most people, sounds like a positive word. And it used to be, and I used to think it was, but I'm going to say it's a bad bet if your goal really is everyone. This system is just way too complex right now. And to think that anybody but the most motivated, the people with time or money to spare, or the people who are maybe a little bit smarter, or maybe even people who have had a lot of practice with the healthcare system. But if you want everybody, I'm going to encourage you to just put that healthcare consumerism mindset aside, because it really doesn't work if your goal is everybody in a company. Principle number 5, get used to imperfect behavior and inconsistent results. Just be okay with it. This system is so complex right now. We don't have to be perfect for the system to work, for your system to work. But what you do have to do is you have to get clear on who you're serving, what success looks like. So when you're off track a bit, you can make the appropriate adaptations. Just like any complex system, management of a complex system, it's really about noticing when you're off path and then adapting and readjusting. So that's a key principle for managing your system. Again, these principles, you don't have to put them all in play, but have them in the back of your mind. And don't be surprised if 2 years from now, a lot of these start to materialize and you don't even know what you did to start them. Key principle number 6, pick the low-hanging fruit. And there's some low-hanging fruit out there. The orthopedic surgery, Chad Gray is here at the Aspirational Health Conference, and he's a company called IMC, and they do just a spectacular job of managing, of presenting the numbers on the savings for when you get in front of orthopedic surgery. And you do that with really organized, highly accessible, affordable, pre-surgical musculoskeletal therapies, whether it's chiropractors, massage therapists, physical therapists. I like it when they all work together. I like it when they work together with primary care. I like it when you add a little pain management in there. There's some low-hanging fruit, but there's some other ones too. Make sure your plan is taking care of diabetes and asthma. Do not let somebody run out of their insulin or not dose their insulin properly because they can't afford a 70-cent glucose strip and then end up in the ER. There's some low-hanging fruit. As a principal, understand what they are in your business. They might be a little different in your business than in my business or somebody else's. If you have a law office, it'll be a little bit different than if you're working if your company is a construction company. Number 7, don't trust the experts. Use us, but understand that we all have biases, especially when it comes to our money. And I spent a lot of years when I moved down here from Canada, Janice and I did, where we just were asking everybody, how do we do this? Why do we do this? And I will tell you that there were pieces of, there were nuggets from everybody, but nobody connected all the dots for us. And it actually led us astray. And we spent a lot more money and time than we ever needed to. And in the end, I wish we had just trusted our own instincts a lot sooner. Quite frankly, it took us about 10 years where we just trusted the opinions and advice of others when we started trusting our own instincts and making it make sense to us, holding the system, holding the people accountable to being logical and making it make sense. We started saving a lot of money in our business. Principle number 8, copy others, but don't copy them exactly. Your people and your company are different. You're not going to have the same funding structure that NUCA has. You don't have the same people you want to serve. The NUCA system is the best system in the world for who they serve and the resources they've got available to them. And as Doug pointed out, they overcame some amazing odds to get it done. If they can do it, I'm sure that you can do it too. And if Janice and I can do it, to doctors from Canada, I'm sure you can do it too. Principle number 8, your plan should get smarter every year. And the only way that's possible is have to own your data. There's a lot of misconception out there about privacy and HIPAA and whether you can own it or not. Let's make it really simple. This helped me a lot. If I ever use data and it hurts somebody, or I've used in a way I can get accused of hurting somebody or holding somebody down from a promotion or not hiring somebody, that's just bad. It's just not the right thing to do. But there's nothing wrong with having the data managed in such a way, analyzed in such a way, so we know where people are going to need help. So we can anticipate their clinical needs, but also anticipate their the obstacles they might have, whether that's getting time off work or childcare or money. But your plan should get smarter every year. And if you don't own your own data, there's not a whole lot anybody can do to help you with it. You're really at the you're really counting on the insurance company as a vendor to give you the information you need. And number 10, it's always a team effort. And this is one of the biggest things here. I saved it for last. So often, and I made this mistakes for years, is I want to hand this off. My HR person is working my broker. Just you guys just deal with it. Tell me the best options, and I'll pick one. But really, they aren't options. What we've learned over the years is that the best company plans, healthcare plans, happen when this happens. When the CFO makes sure the money's available. And if you need the money for everybody, that means you got to lower the cost for everybody, or you could blow your budget. The HR person's job is to make sure that everybody understands the plan and is using it properly. And then the CEO's job is to make the strategic decisions, understanding the vision for the plan and who it's to serve and what are the outcomes you're looking for. The CEO's job is to be very intentional with strategy, because in my opinion, there is no company that should spend a dime on healthcare if they don't know how to get a return on investment. That's my belief on it, and I believe that'll be the belief of many CEOs too. And matter of fact, when we talk to CEOs in the companies that we serve, the number one thing they tell us is that they want is their health plan needs to be a hiring advantage for them. And then it also is a retention advantage, and it can help with injuries and things like that and keep their injury costs down. And number 2 and 3 are accessibility and affordability. But being a hiring advantage is the first thing. So let me hand it over to Janice now.
Thank you, David. I'm Janice Johnston. I'm the Chief Medical Officer with Redirect Health. I'm also a family physician, and so had a lot of experience in terms of treating patients in the traditional healthcare journey, and that's what I wanted to speak to you about here first. And then David will kind of pick it up and see how we beefed it up for our company first, for our own employees to kind of think about healthcare in a different way to make it more effective and efficient, and to really have a system that supported the primary care team. So going through the traditional healthcare journey, David, do you want to put that up? I think it's important that we follow the journey, but we also follow where the money is as well. And, you know, a lot of time we don't think about the money aspect, but in terms of creating a system for yourself and a solution for you and your employees, you have to think about both. In the traditional world, care typically will start with the primary care doctor, although sometimes patients and your employees will skip that step and go right to the end where I'll show you, and they might go right to the emergency room or right to a specialist. So with primary care, we think of that as the routine types of things, the checkups, the well childs, the checking your blood pressure, you know, getting a cough, cold or flu, that kind of thing. Making sure that there's accessible labs, there's prescriptions, there's access to imaging, basic kind of imaging. And then we think about musculoskeletal injuries. Musculoskeletal types of complaints probably make up about 25% of what we see in primary care. And so making sure that we address that, I think, is really, really important. As the patient will progress through the journey, oftentimes they will end up in a specialist's office and will require some advanced imaging. Of course, advanced imaging can happen either in a freestanding facility or in a hospital. And knowing where your employees are going for these types of services really makes a big difference. So, and then from there, then they advance often to surgery or needing some more advanced, what we call specialty drugs. Think of medications that you see advertised on television, like Humira or Entyvio, chemotherapy agents, those kinds of things. Dialysis, organ transplant, nursing, home nursing, going into a rehab facility, those kinds of things. And as you advance through the system, the costs just continue to get higher and higher. With our model, what we've really focused on is to support the primary care at the beginning of the journey to make sure that they have all the support and tools that they need to make sure that the transition to the next step when it needs to happen happens in a really organized, supported way. So no balls get dropped. It's not just sort of, here you go to the next step and not be following that patient or customer through that journey. And by doing so, we can actually take some of the funding that might go towards the end and try to redirect it back, both to support these primary care programs that we've developed, but also put it back into the employer's pocket so that they can come up with other ways to either help to offset the costs of premiums, which we have so many of our clients do. We support thousands of companies now. And so they actually bear the brunt of the whole healthcare journey for their employees. And it's so meaningful, and they get amazing care in the process.
All right,
so David, I'll turn it to you, and you can speak to how we consider it a little bit different with our primary care navigated journey.
Great. And what I want to do is I want to keep it really, really high level. And I want to get the concept out there, because if I make it, I could spend hours on this and how we engineered it, how we built it. But I want to get the thinking out there first. And like I said, we figured it out on our own years and years and years ago. I'm sure other people are going to be able to figure it out too. The journey has all these components that Janice just talked about. But what we've done is we've surrounded the primary care and we expanded it to include the other everyday care things, including a very solid musculoskeletal program. But we always start with population health. We always start with it. And there's so much to population health, but let me just key on some basic things, really basic. If you're an employer, find a way to collect information from your people at least once a year, but really ongoing. That's it all in a private way. And there are ways to do it, but you got it. When we get the information before the plan year even starts, it allows us to do some hit the ground running. We have a whole program for it. We want to know who's got diabetes, who's got asthma, who hit the emergency room 6 months ago because they ran out of an asthma inhaler. We want to know the information and the data on that population, that company, everyone in that company, so that we can anticipate what their clinical needs are going to be in the future, including tomorrow. But also we can anticipate what the obstacles are going to be. And if somebody ends up in an emergency room because of a childhood asthma, it's usually not because the asthma got really bad. It can be. Quite often it's because they ran out of the asthma inhaler, or the babysitter didn't have the asthma inhaler, or the teacher didn't have it. So population health is the starting place for surrounding and supporting our primary care model, and the primary care model that I would encourage every business to put in place. And before you have people actually go into an office, you want to make sure that there's a virtual first primary care available to them. And that's a little different than the normal telehealth that's being sold today, but we're seeing more and more of this concept of virtual first. That doesn't mean virtual instead. There's a lot of the original telehealth services were really promoting themselves as virtual instead of brick and mortar. We see it being a combination, and this is being the entry point. But not just where we have to take a complete history. I'm talking about where we have the complete medical records at our fingertips. And again, Janice is going to share with you some things you can do to just get started with that. And it would mean hiring a nurse or doing something else, just doing something a little more at an advanced level. But getting a virtual first primary care solution into your plan where the medical records are at the fingertips of the professionals answering the phone is critical to supporting the primary care and getting the records ready and supporting the everyday care. The other thing that I would add is that the other thing I can add is after the fact, after you get the primary care visit, sometimes you're going to need specialists and advanced imaging and the more expensive cost centers. And what's really important is you set up some sort of system in your company, if you can. Now I'm getting a little bit advanced on this, but if you can set up the system so that physicians are talking to physicians and doing case management, you're going to find that the amount of care that happens is a lot less. And when you do need care, it'll be a lot more streamlined. And I want to just hit really quickly on second opinion. What we've seen over the years, when we started doing healthcare in the United States, we thought that a second opinion was we send a patient from one doctor to another. What we realize now is that we always got the same answer for the most part, or if we didn't get the same answer, it's often confusing which one was right. What we do today, which is much more effective, is we get the primary care provider to speak with both specialists and to share what the first specialist thought was the diagnosis, what the prognosis was, what the treatment plan was, and then to go and share that treatment plan with another specialist of the same specialty, and then to figure out between the three of them, the three professionals, what's the best route of care. That can seem kind of expensive because you're bringing other doctors in, but if you pay attention to where it is in front of the higher cost centers, you'll see you'll save a lot of money with this. Janice also mentioned that during this healthcare journey, if you really want to take care of all the dimensions of the customer going through it, you better take care of the clinical. That's obvious, but we got to pay attention to the money also, because we got to make sure we can fund it, and we have to take care of the logistics and the customer experience, somewhat of the triple aim. And there are alternative funding management. There's alternative funding management that you can do in your health plan. And because some of your people are going to qualify for various programs, Medicaid, Medicare programs, patient assistance programs. A lot of these medications, if you've designed your plan correctly, you can design out some of the coverage so you can actually get the care for free or at a very significantly lower cost that can be paid for in another way through your plan. And I saw that David Contorno was at this conference, and David is an expert of setting up the plan design so that when alternative funding is available to somebody, and we can use it, including the patient assistance programs. And of course, this manages the insurance well. As a primary care team, there's no sense in making somebody have 2 deductibles because we don't plan the timing of it. That could be a killer for somebody being able to afford it and even not going bankrupt. Because remember, at the plan year, it all turns over and the deductible starts all over again. So this is the healthcare journey that takes money that accumulates at the end of the journey, and it redirects it back into the beginning of the journey. And there's a lot of money that's freed up when we do that. And we care a lot about the real ecosystem that people exist in, and we've got to make sure that our care plan, our healthcare journey that we give to them, that it complies with their lives and their ecosystem. It's our job to comply with our customers. Very similar to what we heard from Doug with the NUCA system, and it's we care a lot about freeing up the money, and I want to get rid of the stigma that's often seen in medicine that it's great clinical care and money have to be separated. If you don't take care of the money, don't be surprised you can't provide great clinical care to everyone in your company. They go hand to hand. And so Janice, I hand it off to you.
Yeah, so really we need a system that is working together. And, you know, all of these things that David has mentioned, they're all pieces of the puzzle. But we have to make sure that they all fit and flow really, really well together. So while having all these pieces is important, it's not just, you know, reaching into a bag and picking out a piece and running with that. It all has to be really, really well oiled, and having a primary care system on steroids, so to speak, where the handoffs happen easily, both between the providers of the care, but also to the customer or the patient itself. That's the most important thing. So, and we really, really want to make sure that people are getting the care that they need and not getting the care that they don't need, or the care that they don't necessarily need right now too. So it's really important to make sure that every customer has a good plan going forward, and every person is different. So what I wanted to do here is to really just kind of go over 5 things that you can think about to add or change with your own benefit plans. The number one thing that I can recommend to you is to eliminate the costs of going to see a primary care and all the things that are associated with what we call everyday care, the common types of things. Having a $10 copay, $20 copay, $50 copay, or even a deductible requirement to go see a primary care is a huge barrier to people. And often what we find is that people will put off their health care because they just don't want to spend just even a minimal amount to get to the primary care. So that's one of the things that we started very early on when we started to think about our own company to redesign what was important to our team. And it made a huge impact just in terms of the accessibility and the affordability for our company. And now, of course, we've moved into other companies as well. And this is something that's worked really well. Everyday care for us includes the primary care visit, where it could be through virtual. And of course, David mentioned that we like the virtual first idea. And we think that virtual first can be used in any situation. And I know that that seems a little weird. So how are you going to treat my, appendicitis through virtual medicine? Well, through speaking to a primary care physician virtually first, we can get a good idea that, hey, this does sound like appendicitis. We're going to bypass the urgent care and get you right to the emergency room, get you right to the care that you need right away. Versus, you call with pink eye, it sounds like pink eye, smells like pink eye. Let's treat it and follow up with you tomorrow. So all of that is going to be at no out of pocket. So everyday care also includes all the basic level, the blood tests, the vaccinations, the x-rays, those types of things. And we also include addressing musculoskeletal care. So in the second one, $0 copay for musculoskeletal care, both in the pre-surgical type of situation, and I can tell you over and over again where we think someone is going to need surgery, but if you really start rehabbing them appropriately and remove the barriers to cost for that, oftentimes the surgeries can be avoided and prevented. Or if they do go to have surgery, they're that much stronger and prepared for the rehab afterwards, can get back to work that much better. As I mentioned before, pain issues represent probably about a quarter of what we see in primary care. And, to go after and try to really tackle some of these issues that employees will face in a way that can avoid medications. So we're, very, very conscious of making sure that we're giving the most appropriate care. And if we can get people back on their feet doing their own programs at home, even doing some simple programs, that seems to work really, really well for us. The third point is really incentivizing and teaching your employees how to make some good decisions. So too often what we see is that people don't understand how to use their healthcare program that they have. They have a card and they think that they need to use that card for everything. But often we find that if we know the cash price up front, it can be much different and much more affordable than using an insurance option. So to make sure that people know that really, really can be helpful and save your employees a lot of money. The fourth point here is about pharmacy spending. And I would encourage all of you to get your employees with an app similar to GoodRx is one that's very, very commonly used, so that they can see what the cost of medications is at their local pharmacy or even the one across the street. There are wide variations in terms of costs of medications. But also, this has worked really, really well for our company, is to have your pharmacy benefit manager just pay for the actual cost of the drug plus the small little transaction fee. Oh, too often there's a huge markup that happens there, and that of course isn't benefiting your employee or your plan as a whole. And then the fifth thing, really, if you want to take it to the next level, is to involve some population health. So to hire a nurse manager, someone who can really, really work with your population to dive deep into what they need and who needs some support and care navigation, making sure that they have the medications that they need or their barriers to care that they can help them move through. We call ours care logistics, and it's worked really, really well to have an advocate on your side, to have somebody reach out to you in a meaningful way, to know when it is that you're going to be running out of your medications, to know when you're going to be due for your lab work. You know, hey, I saw a specialist yesterday, to reach out to you that day or the next day to make sure that we know what the treatment program is so that we can shift gears and make sure to guide you and to remove any barriers of care that might present itself. So when we look at what that cost is per employee with this type of program, when you have a really good primary care system in place, earlier we heard that it was they were looking for a goal of around $7,000. We're finding, you know, with a good primary care system in place, we're looking at about $5,000 to $6,000. But even by instituting some of the things that I just mentioned, those 5 points, you could get to about $4,500 per year per employee, and that's a significant savings overall. With our own employees, we've been tracking this for many years now, and our average is around $2,000. And so we have a culture, a company culture, where we're very engaged with engaging with our system, engaging with our care logistics and our care navigators, always doing virtual first, and we've gotten it down to about $2,000 per year, and that's been sustained for many, many years for us. So if this is part of the thing that you want to focus on, adding even just a few key elements, I think can make a big impact for you.
All right, so let's summarize, and we're running to the end of our time. So your healthcare plan, think of it as it's a system that has to work for you. That makes obvious, but you've got to just make sure you've got the vision for what works for you means, and it serves your people specifically. And use primary care strategy. Use a primary care strategy. Think about eliminating unnecessary activity and spending. It's not just about reducing costs, not reducing the same cost of the same services. There are a lot of services and activities that just don't need to be there. Even like the administration of a copay, it costs money that gets passed down to you. So think about your benefit design. What are the activities that might be indirect that you can eliminate also? Copays are a big one that costs healthcare plans a lot of money. And make sure your health plan, your health system enables you to redirect the spending that always will accumulate at the end of the journey, bring it back into your business or towards the beginning of the journey. And make sure it's easy and truly affordable for your people to use. What we found, and man, every company we work with has some sort of money constraint. We always had money constraints in our own company. So the way that we get people to want to do the things they want to do and show the behaviors that we want them to show, and I don't mean in a perfect way, but I mean in a better way, in a way that continues to get better, is we have to make it easy and we have to get truly affordable. Zero copays in the things that we wanted them to focus on first. was always the easy way. But we had to make it easy to get people to want to do what we wanted them to do. And I think your health plan system should be there to hire and retain with. And I think it needs to be easy to budget year over year. And that'll never happen if you don't have your data, you don't own it. Don't think because somebody told you, a broker or an insurance company tells you you own your data, you can get your data, that you really can. You need transactional data. Doesn't mean you look at it, but somebody on your team or somebody you hire needs to analyze your data, transactional data, so they know who is going to which hospitals for which conditions, who's paying $300 for a medication when they should be paying $3 for the same medication, who just spent $80,000 for a surgery when that surgery should have been $10,000. You need that transactional data and someone to analyze it, but don't be surprised if people aren't trying to fool you. The vendors of healthcare, even Walmart did not know that they didn't own their data before they switched from their last insurance carrier. You can get your data, but you have to ask for it, and then you have to verify that you got the transactional data you needed. So we're wrapping up, and we might have a few minutes left for questions, but I'll turn it over to you, Lee.
No, terrific. This has been wonderful. Yeah, and really has given us a lot to think about and a lot to work on. Not much time for questions, but I think one that I'd love to have, everyone is encouraged to you and to visit your booth. How decide where to refer? So if I'm in any town, USA, do my doctors decide where to refer to specialists? Does the employer? Do we do it together? And using what data?
So the employer wouldn't. They'd be out of the mix for sure. But it's a combination of our team, our medical team, the local medical team on the ground, and the individual. And it is just figure out, what do we need? What's the most efficient way to get that? And what's the most effective way and efficient way to pay for it? It's all part of that journey. So we think of that journey as just being done over and over and over and over and over again every single day in a multidimensional way for people.
Terrific. Well, thank you both for this presentation. This is incredible, and it's given us a ton that we can sink our teeth into and begin to work on. And we look forward to learning more during the course of the conference and interacting with you at your booth, and aside from that as well at the discussion sessions.
Thank you.
Thank you, Lee.
Thanks, everybody.